Hello, doctors. I think it's very important today to have injury doctors pick up all the injuries in the spine that the patient has. I don't think any doctor would disagree with me. One of the most prominent areas that seems to be one of the most missed areas in the cervical spine injury is, of course, the upper cervical injury. Now, the upper cervical injury is of particular importance because of the neurology that's involved. So an upper cervical injury today will mimic just about every symptom of a mild traumatic brain injury. As a matter of fact, in the mild traumatic brain injury space, we know today that there are 6 clinical trajectory patterns, 6 things that we're looking for, right? We're looking for visual disturbances. We're looking for balance difficulties. We're looking for cognitive problems. We're looking for behavioral problems. We're looking for headache problems. And the most important space in the mild traumatic brain injury space is, of course, the cervical profile. Now, that's the one that so few doctors today understand. And if we want to turn around the awful results created with mild traumatic brain injuries, then we have to have doctors that truly understand the cervical profile, the cervical injury. The cervical injury is probably the most important injury in all of the mild traumatic brain injury space. Now, I'm not saying that a severe injury to the brain is not important. Don't misunderstand what I'm saying here. What I'm saying is that the cervical instability caused by ligament damage in the upper cervical spine will mimic all of the symptoms of a mild traumatic brain injury. So let's take those 6 clinical profiles again, right? So I could damage your eye and you would have visual disturbances, but I could damage your eye without ever damaging your cervical spine. I could damage your inner ear, you will have balance difficulties, but I can do it without ever damaging your cervical spine. I could give you unbelievable duress. I could say your business is going down, you're getting divorced, you're under IRS audit, and any one of a number of other things. You're an alcoholic and you're finally just realizing that you're an alcoholic and you have to change, and you would take a cognitive test and you wouldn't score well. But those circumstances in your life are not going to cause a cervical injury. You could have a hormonal problem with headaches, and that's not going to cause a cervical injury, right? So you could have bad behavioral problems due to other issues, and it's not going to cause a cervical injury. Now, here's the thing about the cervical injury, though. So while none of those other symptoms or none of those other clinical profiles can cause a cervical injury can cause every single one of those symptoms. That's why that's why in my world, it's the senior part of the mild traumatic brain injury space. It's so important and so little understood. Most doctors don't understand. It's pretty simple imaging series. You're taking flexion extension, you're looking at C2, C3, C3, C4, and then you're also taking an A to P open mouth stress view to see what the atlas is doing on the axis. You want to see what the upper cervical ligaments are doing, and it's a simple x-ray study. And it's probably one of the most, like I said, it's one of the most important studies. Right now, many American headache foundations will say that 1 in 4 households that you drive by has a migraine headache sufferer. Now, look at this complex. That migraine headache sufferer, right? Would you say, well, they had a traumatic brain injury and that's what's causing it? Probably not. The first thing you're going to look for is a cervical condition. If you're smart, that is the primary thing that you're going to be looking for initially. And if it's there and you fix it, you stabilize it, it should have a dramatic effect on the symptom. So providers today could build unbelievably large headache clinics just with the radiographic findings of upper cervical instability as the main cause of that condition, and then developing treatment protocols that treat that condition. So the upper cervical injury is one of the most important injuries that you should be assessing. It's assessed right on x-ray, which follows the Nexus guidelines, which follows chiropractic x-ray guidelines, which follows medical imaging guidelines. It follows it completely. It's just too few doctors understand how to do it. So at Spinal Kinetics, one of the things that makes us unique is that we're elevating the profession on excessive motion testing. One of the things that a lot of doctors sometimes have an issue with is positioning. So if you have a problem with positioning, call our office, call Spinal Kinetics, and we'll get you our positioning guide. If you don't have an account set up with Spinal Kinetics and you want to find out more about it, just call Spinal Kinetics and set up an appointment with one of our customer service people, and we'll explain to you exactly what it takes to get an account with Spinal Kinetics. It's very easy. But I highly recommend that if you're going to be in the injury space, I've said for years, people who are injured cannot afford to go to doctors that don't understand their injuries. There's too much at risk long term for the person's life dealing with a doctor that doesn't fully understand their injuries. And when you're working with a cervical injury, the upper cervical workup has got to be done. If not, to me, I think the doctor is deficient in their workup and possibly should not be in the injury space treating these types of injuries. Doctors, I hope what I've said to you helps. Again, if you have any questions, just contact Spinal Kinetics. If you want the positioning guide, contact Spinal Kinetics. And if you want to set up an account with us, just contact us. We're easy to work with, and we've been doing this for a very long time. And we're more than willing to help.